Hello everyone. In this session, I am going to discuss a very important topic, that is hypersensitivity. So we will be discussing all types in detail one by one. Let's start hypersensitivity. So before coming on the various types of hypersensitivity, please understand what is hypersensitivity. You know, human body have immunity. We all have immunity inside us. So our immune system is activated against the foreign particle, not against the self. The immune system is active against the foreign particle, not against the self. I am repeating, right? So the immune system is defense mechanism. No? It is good for us, right? It is good. Whenever any foreign particle enters inside us, it can be bacteria, virus, fungus, parasite, anything. The immune system, the immunity get activated and try to do the defense, right? That is immune system, that is protective for us. But sometimes the immunity is exaggerated, and instead of killing only the foreign particle, it is causing harm to the host cells also. It is known as hypersensitivity. What is hypersensitivity? Hypersensitivity is the excessive reaction. Excessive, it is the exaggerated state of the normal immune response, which results adverse effects in the body. So it is causing the disease, the tissue damage in the host also. So instead of killing only foreign, it is killing the host also. It is killing foreign, but it is killing host also because it is exaggerated. And that is known as hypersensitivity. Right? Coming on the classification of hypersensitivity, there are two types of hypersensitivity, the immediate one, the delayed one. The immediate one occurs within seconds to minute, and it is B cell mediated, that is humoral immunity. Humoral immunity. The delayed one occurs after 24 to 48 hours, and this one is T cell mediated, that's why cell mediated immunity. We know we have two types of immunity, the humoral immunity and the cell mediated immunity. The humoral immunity is B cell mediated, B lymphocyte, and the cell mediated is T lymphocyte mediated. So in type 1, 2, 3, the B cell is involved, and in type 4, the T cell is involved. So basically, according to Coombs and Gell classification, there are four types of hypersensitivity, type 1, 2, 3, 4. Type 1, 2, 3, the B lymphocyte is involved, and that's why it is humoral immunity, and I will let you know how antibodies are formed here. In all of them, antibodies is formed. There are 5 types of antibodies, IgG, IgA, IgM, IgD, Ig. So different types are formed in different types of them. I will let you know when I teach you the details of each of them. But the type 4 is T cell mediated. You know, T cell means cell mediated immunity. So here antibodies are not formed. Here direct cytotoxic killing is there. So please learn. I am going to teach you according to Coombs and Gell classification the 4 types of hypersensitivity one by one. Let's start with type 1. Let's start with type 1 hypersensitivity. The name of the type 1 is allergy. You know, type 1 is basically allergy. The type 1 is allergy. Now it can be of two types. You know, just suppose if I eat anything and I have diarrhea, particularly after eating certain specific food. So I'm having the GIT allergy. If I apply some cosmetic or something on the skin and I am having dermatitis, so I'm having skin allergy, the dermal allergy. If I inhale something, the dust or something, some pollen grain, and I'm having the sneezing after that, so I'm having respiratory allergy. So allergy can be localized. The localized allergy is known as atopy. The localized allergy is known as atopy, and sometimes it can be systemic, in which the complete body is involved, and it is the most severe form of allergy. It is known as anaphylactic reaction, anaphylaxis. So basically allergy is of two types, the localized and the systemic. The localized one is known as atopy, and the systemic one is known as anaphylaxis. Can you see? So it is of two types. Both of them are known as allergy, right? Now coming on the pathogenesis, instead of showing you here, I would like to draw it. Imagine an antigen. The antigen is an allergen. It can be pollen grain, it can be dust, it is entering the human body. So as soon as it enters the human body, the first cell which engulf it, which interact with it, is antigen presenting cell. Learn the sequence of the cell. So antigen presenting cell will engulf this antigen, degrade into multiple pieces, process it and present it on the surface. It will present it to the next cell. The next cell is helper Th2, not 1. Please mind my words. So this is presenting the antigen to the helper Th2 cell. The helper Th2 cell will get stimulated. On stimulation, it will secrete the cytokines from it. It will secrete interleukin 3, 4, 5. The interleukin 4 is important. That will go and stimulate the next cell. The next cell here is the B lymphocyte. B lymphocyte gets stimulated and it will convert into plasma cell. The B lymphocyte convert into plasma cell. So the next cell is the B lymphocyte. It will convert into plasma cell. The plasma cell will start forming antibodies. It will start forming antibodies. Which antibodies? So there are 5 types of antibodies now: IgG, IgA, IgM, IgD, IgE. So it will form IgE type of antibodies in type 1 hypersensitivity reaction, to be very specific. These IgE antibodies will go in blood. In the blood, mast cells are present. These are the mast cell. So these IgE antibody will bind to the mast cell on their surface with their Fc portion. With their constant fragment, it is binding there and remain there forever. This is known as sensitization of mast cell. This is sensitization of mast cell. The story is over, right? Now, if the same antigen enters, this was the first time. If the same antigen allergen enters second time onwards, it can be second, third, fourth, fifth, sixth, any subsequent time. So the whole process is not repeated again. The body have a memory. The immunity have a memory. So it will be directed directly towards the Ig antibody which are present for it. So we have already formulated the specific antibodies for this allergen, and the process is not repeated again. It is directly going to Ig antibody second time. As soon as the antigen bind on the surface of the antibody like this, as soon as it will bind, the Ig antibody will give signal to the mast cell. It will give signal to the mast cell. The mast cell contains granules inside it. So mast cell will burst and the granules will come out. This step is known as degranulation of mast cell. It is known as degranulation of mast cell, and the granules contain many important substances like histamine, serotonin, interleukin, prostaglandin, leukotriene, platelet activating factor, and they all are responsible for allergy. The various effects of the allergy. They cause bronchoconstriction, they cause vasodilatation, they cause increased permeability, leading to edema, leading to respiratory problems. They cause allergy. This is the mechanism of the allergy. I hope you got the sequence of the cell and the complete sequence, right? So let me show you the same here also. Here you can see this is the antigen which is entering human body the first time. It is going to antigen presenting cell. It is degrading it and taking it to helper Th2 cell. The helper Th2 cell secreting interleukin 4. It is stimulating B lymphocyte. B lymphocyte convert into plasma cell. Plasma cell form IgE antibody. IgE antibody going to mast cell and bind on the surface of the mast cell forever. Same antigen coming again. So directly going to the mast cell antibody, the signal is given to mast cell, the mast cell is bursting and degranulation takes place, the granules cause the allergy. So same thing is written when the antigen enters first time. Can you see? When the antigen enters first time, it is taken by antigen presenting cell. Antigen presenting cell takes it to helper Th2. Helper Th2 secrete interleukin 4. Interleukin 4 stimulate B lymphocyte. B lymphocyte convert into plasma cell. Plasma cell will form IgE antibodies. Ig antibody go to the mast cell, bind with Fc fragment with the mast cell. This is known as sensitization. Now the same antigen enters second time. It will directly go to the antibodies, Ig antibodies present on the mast cell. The mast cell will burst, and this is degranulation of mast cell. From the degranulation of the mast cell, can you see this diagram? So these are the IgE antibodies present on the surface of the mast cell. Can you see this is the antigen coming and binding? As soon as the antigen coming and binding, the signal is given. So mast cell is bursting, and can you see the granules are coming out? The granules contain all these things. The granules may contain histamine, serotonin, vasoactive intestinal polypeptide, chemotactic factors, leukotriene B4, D4, prostaglandins, platelet activating factor. They all are responsible for allergy. They all are responsible for allergy. So the same diagram shown to you, that's all about it. That is type 1. Now coming on the examples of type 1. In the examples of the type 1, there are many examples. All allergies are there. Do you know eczema is allergy? Hay fever is allergy. Atopy, asthma, urticaria, anaphylactic shock, dermatitis, these all are allergy. You can identify, you can write, you know the names of the allergy. But Theobald-Smith phenomenon, Putzner-Kutzner reaction, Cassoni skin test, and Schultz-Dale phenomenon. These are also allergies, but you cannot recognize them because these are the named reaction. So let me give you a mnemonic for the named reaction, not for normal allergies. So because type 1 includes all allergies like asthma, hay fever, urticaria, dermatitis, anaphylactic shock. Along with that, it contains PCTS. PCTS, what is, you can say proximal convoluted tubule, it's a mnemonic. So P stands for Putzner-Kutzner reaction, C stands for Cassoni test, T stands for Theobald-Smith phenomenon, and S stands for Schultz-Dale phenomenon. So these are the examples of type 1. You know the pathogenesis, you know the examples. Coming on type 2, the type 2 hypersensitivity. So here the pathogenesis, let me draw it. Here the antigen is not present alone. The antigen is present on the target cell, which is a host cell. The antigen is present on the surface of a target cell, which is a host cell. So as soon as it comes in the human body, it will not go to antigen presenting cell. It will not go to T lymphocytes, helper T lymphocytes. It will directly stimulate B cell this site. This time this will directly stimulate the B lymphocyte. B lymphocyte convert into plasma cell as usual. So the antigen which is present on the surface of the target cell going to B lymphocyte, it is converting into plasma cell. The plasma cell will form antibodies. Which antibodies? So last time in type 1 it was IgE, but this time it is IgG or IgM, not IgE, right? So these antibodies will go and bind on the surface of the antigen. Like this, they will bind, right? So antigen antibody complexes are formed. Because of formation of antigen antibody complexes, the complement will get activated, especially C3b. You know what is C3b complement? So C3b complement will get activated, and that is acting as a opsonization. You know opsonization. In the end, a phagocyte will come. The phagocyte will engulf the assembly. It will engulf everything. It will engulf the antigen, the antibody, the complement, and the target cell, which was a host cell. So here the end result is phagocytosis. You got my point? So it is harming the host cell. In hypersensitivity, the host cell is also harmed. So here the antigen is present on the surface of the target cell. It is directly going to B lymphocyte. B lymphocyte converted to plasma cell. The plasma cell forming IgG or IgM antibodies. The antibodies are forming complexes with the antigen. It is activating complement, especially C3b, which is acting as a opsonin, and it is resulting in phagocytosis. So this is the most simplest way I can tell you in the form of the flowchart with the diagram. The same thing is shown in the diagram. Can you see a target cell? Can you see the antigen present on the surface of the target cell? Can you see the antibodies which are formed? These are the antibodies which are formed. Can you see? Just a second. These are the antibodies. These antibodies are IgG or IgM, not IgE. The antibodies will come and bind on the surface of the antigen with target cell. Antigen antibody complexes stimulating, it is stimulating the complement, especially C3b, and this is a phagocyte engulfing everything. So I hope you got it. Coming on the examples of type 2. For examples, I am having a mnemonic. The mnemonic is my blood group is Rh positive. M stands for myasthenia gravis. B stands for blood transfusion reaction. G stands for good pasture syndrome and Graves' disease. I stands for insulin resistant diabetes and ITP. R stands for rheumatic fever. H for hyperacute graft rejection, and P for two things, pernicious anemia and pemphigus vulgaris. So learn the full form. Okay. Coming on type 5, I taught you type 1, I taught you type 2. Now instead of type 3 and 4, first I am teaching you type 5, because type 5 is a special type of type 2. So immediately after 2, you will have a better understanding of type 5. So the only difference in type 2, what was the end result? The end result was phagocytosis. The antibodies were inhibitory in nature. They were causing phagocytosis. But here the antibodies are stimulatory in nature. Instead of killing or doing the phagocytosis, they will do the proliferation. So that is the only difference. So Graves' disease and myasthenia gravis, from these only actually, the myasthenia gravis and the Graves' disease are actually example of type 5. So if type 5 is given in the option, go with that. If not given, go with type 2. So basically type 5 is a special type of type 2, which is stimulatory type. So antibodies, instead of inhibiting or killing, it is stimulating them. That's it. Coming on type 3, we are done with type 1, we are done with type 2, we are done with type 5. Now coming on type 3 and 4. So type 3. So let me draw the pathogenesis for you. Here the antigen is a soluble antigen. The antigen is not allergen. The antigen is not present on the surface of target cell like type 1 and 2. It's a soluble antigen. As soon as it enters the human body, it will directly go to B lymphocyte. It will stimulate the plasma cell like type 2 only. The plasma cell will form the antibodies. Which antibodies? Again, like type 2, it's IgG or IgM antibodies. Right? These antibodies will go on the surface of the antigen and bind with the surface of the antigen. Antigen antibody complexes are formed. It will stimulate the complement. But which complement? This time it's not C3b, it's C5 to C9. That is membrane attack complex. C3b was a opsonin. It was a opsonin, so causing phagocytosis. But C5 to C9 is membrane attack complex, so it will lead to inflammation. So the end result here is the inflammation. I hope you got it. So here the antigen is a soluble antigen. It will directly stimulate B lymphocyte. B lymphocyte convert into plasma cell. The plasma cell will form the antibodies, right? Antibodies bind with the antigen and form the complexes. Antigen antibody complexes are formed. These complexes will get deposited on the tissue and stimulate the complement. The complement here is C5 to C9 membrane attack complex that will result in inflammation. So that's all about it. The same story is seen in the form of the diagram. I have drawn the diagram, better diagram for you. Coming on the examples, the example is the SHARP, SHARP, 5 examples, SHARP. The S is triple S, 3 S are there. It's serum sickness, Sheik test and SLE, triple test. H stands for HS purpura. A stands for arthritis reaction. R stands for reactive arthritis. And P, there are 2 P, polyarthritis nodosa and post-streptococcal glomerulonephritis. So that is type 3. Coming on the last one, type 4. We will compare all 4 again, don't worry. So let me first explain, then I will again compare all 4 pathogenesis as well as examples. The type 4. In the type 4, it is known as delayed hypersensitivity. It is T cell mediated. Here antibodies are not formed. In type 1, IgE antibodies are formed. In type 2 and type 3, IgG and IgM are formed because B cells stimulated in all of them. But in type 4, no B cell stimulation, directly T cell stimulation is there, right? So here this one is slow, prolonged and delayed, and it is T cell mediated. So here in the pathogenesis, an antigen will come. This is the antigen, right? It will go to antigen presenting cell like type 1, right? Antigen presenting cell will take the antigen and try to degrade it. But this antigen is non-degradable. Non-degradable antigen, it is unable to degrade it. So it will carry it to the next cell. The next cell is helper Th1. Please mind my words. In type 1, it was helper Th2. Here it's helper Th1 cell. The helper Th1 cell will secrete 3 cytokines from it. The 3 cytokines. It's interferon gamma. The first is interferon gamma. The second is interleukin 1 and 2. And third is TNF. They will take one cell from the blood. They will take out one cell from the blood. You know, so interferon gamma will take the monocyte out and convert them into macrophage, and they will modify the macrophage into epithelioid cells. Epithelioid cells fuses with each other and they form the giant cells, right? That is the first thing. Second thing, interleukin 1 and 2, they will take the lymphocytes, T lymphocytes from the blood, and TNF alpha, it will take the fibroblasts from the blood. Now these 3 cells will form a granuloma. So the end result here is the granuloma. You got it? So antigen is coming, which is non-degradable. It is captured by antigen presenting cell. It will take it to helper Th1. Helper Th1 will secrete the cytokines TNF alpha, interferon gamma and interleukins. That will form a granuloma. That is the end result. That is the end result. You can see in the end a granuloma is formed here. A granuloma is formed here. You can see this is the granuloma. So that is the end result. What are the examples of type 4? I am having again a mnemonic for you. The mnemonic is John gave tulip popcorn to Hershey. So John stands for John Motte reaction. Tulip, tuberculin lipramin. Pop, pernicious anemia. Corn, contact dermatitis. And Hershey is Hashimoto thyroiditis. You got it? So these are the 4 examples of type 4 hypersensitivity. So type 1, 2, 3 is antibody mediated. So B cell mediated. So humoral immunity. Type 4 is cellular mediated. T cell mediated. It is delayed one. These 3 are immediate. This one is delayed. Right? So what is the summary? What is the pathogenesis? Can we revise the pathogenesis of all 4 together at one shot? Type 1, type 2, type 3 and type 4. We will try. So in all of them the antigen is coming. Here the antigen is allergen. Okay, here the antigen is present on the surface of a target cell. Here the antigen is soluble, and here the antigen is non-degradable. So see, the antigen is different in all of them. Here the antigen go to APC in type 1. APC will go to helper Th2 cell. It will secrete multiple cytokines. The most important is interleukin 4. Interleukin 4 go to the B lymphocyte. B lymphocyte convert into plasma cell. Plasma cell form IgE antibody. It will go on the surface of the mast cell and remain there only. If the same antigen enters again, it will directly go to the IgE antibody present on mast cell. The mast cell will burst and it will result in degranulation. And the granules coming out will lead to allergy. So the end result here is allergy. Allergy is the end result. We are done with type 1 in short. Coming on type 2 and 3, parallel. Right? Here also the antigen is there but present on the surface of target cell. Here the antigen is soluble. The next cell, they will go directly to B lymphocyte. Both of them, here also, here also. B lymphocyte convert into plasma cell in both of them. Okay, plasma cell will form antibodies in both of them. The antibodies is IgG or IgM in both of them. Till now, everything is common. Till now, type 2 and type 3. This antibodies will bind with the antigen. Here also it will bind with antigen-antibody complex. Here also it will bind with antigen-antibody complex. It will stimulate the complement in both of them. But here complement is C3b and here complement is C5 to C9. So that makes a difference. C3b is a opsonin. So in the end a phagocyte will come and engulf all of them. And result is phagocytosis. And C5 to C9 is membrane attacking complex. It will result in inflammation. So the end result is inflammation. See, in type 1 the end result is allergy. In type 2 the end result is phagocytosis. In type 3 the end result is inflammation. Coming on last, type 4. So here type 4, the antigen is non-degradable antigen. The first cell it will go is APC. APC will try to degrade it but unable to do so. So it will take to helper Th1 cell. In type 1 it was helper Th2, here it's helper Th1. Helper Th1 secrete 3 type of cytokines. The interferon gamma, the most important, TNF alpha and interleukins. They will take one cell from the blood and the end result here is the granuloma formation. granuloma. See the end result in all four, the crystal clear concept, the four type of pathogenesis, the four types of hypersensitivity. Let me tell you the examples of each of them. Type 1, type 2, type 3 and type 4. The examples of each of them. The type 1 examples are, what was the example? All allergies. How many allergies you know? Atopy, urticaria, dermatitis, you know, many types of asthma, all types of allergy, hay fever, along with PCTS. I hope you know the full form of PCTS. Right? It's Putzner-Kutzner reaction, Cassoni test, Thibaut-Smith phenomenon and Schulz-Dale phenomenon. Type 2 is my blood group is Rh positive. Try to see the full form. Type 3, the mnemonic is SHARP, SHARP. S is triple S and P are 2P, PAN and polyarthritis nodosa. The triple S is SLE, Sheik's test, you know, it's Sheik's test, and the third one is serum sickness. Type 4 examples are John gave tulip popcorn to Hershey. Okay, so what is the full form? John Motti reaction, tuberculin test, Lipramin test, pernicious anemia, contact dermatitis, Hashimoto thyroiditis. So try to say the full form, learn the four pathogenesis, learn the four examples, that's it. The same summary is given to you, the pathogenesis, the four pathogenesis are in front of you. You can revise. We have just revised the four pathogenesis. See, the end result is allergy, the end result here is the phagocytosis, the end result here in type 3, the end result is inflammation. Just a second. In type 3, the end result you can see it's inflammation, and in type 4 it's granuloma formation. So see the end result and see the mechanism. In type 1, 2, 3 the B lymphocytes are involved forming antibody. But in last one no antibody formation, it's the granuloma formation. We have seen the examples of all four. I'm not revising it again. Let's solve some MCQs based on hypersensitivity. The first question is in front of you. Ram Devi presented with edema, sweating, flushing, tachycardia, fever after a bee sting. The most important clue is the bee sting. Can you identify which type of hypersensitivity? Is it T-cell mediated? Is it Ig mediated? Is it IgG mediated? Or is it IgA mediated? So let me give you a clue. The bee sting is type 1 hypersensitivity. All insect sting will lead to allergy. So it is described as an allergy. The symptoms are of allergy after an insect bite. So allergy is type 1. Now give the answer. Can you please try? I had given you a big clue. Can you please try it out now? What is the answer? You all are right. The correct answer here is the IgE mediated reaction. You know, because in type 1 IgE antibodies are formed. The next question, let me read it for you. There is a 40-year-old man having chronic cough, fever for several months. On chest x-ray, he is having diffuse reticulonodular pattern. On biopsy, there is a focal areas of inflammation containing granuloma, Langerhans giant cell and lymphocyte. Can you tell me the type of hypersensitivity which is involved? Now they are describing granuloma. So granuloma is the end result of which hypersensitivity? Is it type 1, 2, 3, 4? The question is big but very simple. They are asking for granuloma. Which type of hypersensitivity? You can try. I hope you all are right. The correct answer is the type 4 because the end result of type 4 is granuloma. The next question is in front of you. Example of type 4 hypersensitivity. Can you tell me the example? Farmer's lung, contact dermatitis, immediate hypersensitivity or myasthenia gravis. Apply the mnemonic. John gave tulip and popcorn to Hershey. Now can you please try? You all are right. The correct answer is the contact dermatitis. You know, popcorn C is the contact dermatitis. Myasthenia gravis is type 2 and type 4 is delayed type. The remaining are immediate type. It is not immediate, it is delayed type. So correct answer is contact hypersensitivity, contact dermatitis. The next question is in front of you. Example of type 2 hypersensitivity. Is it blood transfusion, arthritis reaction, hay fever or post-streptococcal glomerulonephritis? So apply the mnemonic of type 2. What is the mnemonic? My blood group is Rh positive. Now say which of the option is coming in this mnemonic. Apply it. Can you please try? I hope you all are right. The correct answer here is the blood transfusion. B for blood transfusion. Arthritis reaction is type 3. Hay fever is type 1 and post-streptococcal glomerulonephritis is also type 3. You can apply the mnemonic and make out. That's all about it. I hope you learned the topic well, the 4 hypersensitivity, the 4 pathogenesis and the 4 examples. That's it. Hello everyone. I hope you understood this topic with crystal clear concepts. Now, if you want the notes of this topic and all my YouTube session notes, then you can click on the link which is pinned in the comment box. Thank you so much for your kind attention, for your patience, for your valuable time. Now here a QR code is provided to you. You can scan it if you wish, and via scanning it, you can connect with me on various social media platforms like Instagram, Telegram, WhatsApp, where I share educational content which will be very useful for you. So if you wish, you can take the snapshot or you can scan it directly. And here is a contact number provided to you. You can save this contact number. It's 9833032948. This is for WhatsApp support, chat support. It is not for calling. So if you have any doubt in the topic which I'm teaching you in this session, and if you have any doubt in other topics also in pathology, pharmacology, microbiology, PSM, medicine, you can text your query here. And if you have any topic in your mind and you want me to take that topic, to schedule that topic in YouTube, so you can also text that topic here. So if many students are demanding the same topic, we will schedule it soon. So thank you so much. Wishing you all the best. Bye-bye.